Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look. Hi everyone, I'm so excited to share with you a comprehensive guide on Hyoscine, also known as butylscopolamine bromide, an effective antispasmodic medication. Whether you're a patient or just curious, this video is for you. Hyoscine is mainly used to treat spasms in the stomach, intestines, and bladder. Imagine you're dealing with abdominal cramps or irritable bowel syndrome. That's where Hyoscine comes in to provide relief. But how exactly does it work? Hyoscine blocks certain chemical signals in the nervous system that cause muscle spasms, essentially calming the internal muscles. It's like telling your body to relax during a cramp attack. Now, let's move on to dosage and administration. It's crucial to follow your doctor's instructions. Usually, the initial dose may be higher, followed by a maintenance dose to keep symptoms at bay. Always make sure to swallow the tablets whole without crushing or chewing them. However, like all medications, Hyoscine has its effects. You may experience dry mouth, dizziness, or blurred vision. Remember that it's essential to check with your doctor if side effects persist or worsen. In conclusion, Hyoscine can be a game changer for those suffering from spasmodic diseases. Just make sure you use it correctly and under professional guidance. Always keep the lines of communication open with your doctor to ensure the best treatment results. Thank you for watching this video and take care. If you've made it this far, let us know in the comments why you're using this medicine.